External examination. The examination is carried out in a well-lit room, and supporting equipment includes a torchlight and simple magnification. Slit lamp examination in a partially darkened room is an added assistance when available. The examiner is directly in front of the seated patient. In clinical practice, the symptoms will usually direct the examiner's attention to the relevant structure. The orbit. Inspecting both eyes when in front of the patient should normally show the eyes to be symmetrically placed in the orbits. Bulging forward, known as proptosis, of both eyes is usually obvious, as in thyroid eye disease, or if one eye is affected more than the other, this could be caused by an orbital tumour. The eyelids. The skin of the eyelids and of the adjacent part of the face is inspected for any signs of abnormality such as redness. Rashes and swellings, as seen in herpes zoster ophthalmicus and molluscum contagiosum, and lumps such as caused by chalazion. The position of the lids is noted. Is this the same on both sides? Drooping of the upper lid, orthosis, especially if recent and one-sided, is an important sign. The lids may be turned in an entropion or everted, as in ectropion. Retraction of the lids may be seen. The eyelashes should be evenly distributed and not in contact with the cornea. The conjunctival lines, the inner surface of the lids. The lower lid, conjunctiva and inferior fornix, is easily seen when gentle traction is applied to the lower lid. The upper lid has to be everted to show its underlying conjunctiva. This is achieved by placing a blunt object, for example a cotton bud, on the lid crease of the upper lid and holding the lashes, enabling the lids to be folded over and the undersurface seen. Foreign bodies and other abnormalities such as enlargement of follicles, papillae and scarring may be found. The bulbar conjunctiva is easily seen, but lid eversion to show the conjunctiva under the upper lid must be performed routinely in a patient presenting with a painful red eye. The lacrimal apparatus. The lacrimal gland is only seen if it enlarges. Swelling, sometimes affecting both eyes, is seen at the outer part of the upper lid. The puncta can be inspected by gently everting the medial ends of the lid. The lower punctum is the most important for the drainage of tears, and it should sit in contact with the tear film at the medial side of the globe. The normal canaliculi lacrimal sac and nasal lacrimal duct are not visible on clinical examination. The lacrimal sac may become enlarged, mucocil. Obstruction in the nasolacrimal duct, and if the skin is infected overlying the sac, may become red and painful, dacryocystitis. The cornea. The following may be seen. Gross pathology, such as perforations, foreign bodies, can be seen easily. Corneal haziness. The combination of the orange dye fluorescein and the blue light provides a very useful way of testing the integrity of the corneal epithelium. This may add valuable diagnostic information to a wide variety of corneal conditions and should be part of the routine examination of the painful red eye. This appearance is disturbed if the corneal epithelium is disrupted to allow fluorescein to stain the stroma underlying the epithelium. The epithelium may be damaged by trauma, either major, as in chemical injuries, or corneal perforation, or minor, such as corneal foreign bodies, abrasions, or recurrent erosions. Breaches in the epithelium caused by corneal ulceration are also easily detected. These ulcers may be infective, for example viral, such as herpes simplex, bacterial, or fungal, the latter being especially likely in agricultural workers, or they may be non-infective. In summary, with careful observation and simple equipment, much information can be gained about the conditions affecting the tissues around the eye and of the outer layers of the eye itself. This will enable the examiner to identify simple problems and also sight-threatening diseases.